This is Barry Zalma for Zalma on Insurance on YouTube. I am a retired from the practice of law lawyer, a certified fraud examiner, an author, and an expert witness on claims and claims handling. Today we're going to talk about 4 Detroit area physicians who were found guilty of healthcare fraud in an over $150 million healthcare fraud scheme. Spilios Pappas, 62, of Lucas County, Ohio. Joseph Betro, 59, of Oakland County, Michigan. Tariq Omar, 62, of Oakland County, Michigan, and Mohammed Zahoor, 53, of Oakland County, Michigan, were each found guilty of 1 count of conspiracy to commit healthcare fraud and wire fraud, and 1 count of healthcare fraud. A federal jury found the 4 Detroit area physicians guilty February 4 of 2020 for their roles in the scheme to administer unnecessary back injections to patients in exchange for prescriptions of over 6.6 million doses of medically unnecessary opioids. Patients were required to get the injections in order to get the prescriptions, some of which were resold on the street by drug dealers. 17 other defendants, including 8 other doctors, previously pled guilty in connection with the investigation. According to evidence presented at trial from 2008 to 2016, Pappas, Betro, Omar, and Zahoor worked at numerous medical clinics in Michigan and Ohio, which were operated under the name of Tri-County Group and owned by co-conspirator Mohammed Zahoor. While the defendants worked at Tri-County, they engaged in a scheme to defraud Medicare of over $150 million by billing for medically unnecessary facet joint injections, unnecessary urinary drug screens, home health, and a myriad of other unneeded ancillary services. The evidence showed that the patients, some of whom were suffering from legitimate pain, and others of whom were drug dealers or opioid addicts, were offered prescriptions of oxycodone 30 milligrams by the defendants, but were forced to submit to unnecessary facet injections in exchange for the prescriptions. Testimony at trial established that the patients experienced more pain from the shots, in some cases, than from the pain they had purportedly come to have treated, and that some patients developed adverse conditions, including open holes in their back. Patients, including patients who were addicted to opioids, who told the doctors they did not want, need, or benefit from the injections, were denied medication by the defendants and their co-conspirators until they agreed to submit to the expensive and unnecessary injections. The evidence further established that the defendants repeatedly performed these unnecessary injections on patients, as Tri-County was paid more for facet joint injections than for other medical clinics in the United States. The 4 defendants were all ranked in the top 25 doctors for dollars paid by Medicaid for facet joint injections, even though they only worked a few hours a week. The defendant's practice was described during trial as an assembly line, where the 4 defendants earned anywhere from $1,100 to $3,500 an hour for performing the same injections on nearly every patient. In addition to the unnecessary injections, the defendants signed a standing order for urine tests for each patient and for every visit to be sent to national laboratories, also, of course, owned by Rashid, in exchange for tens of thousands of dollars in illegal kickbacks. The evidence further established that the physicians performed a quantitative test for 56 different drugs for every patient at every visit, regardless of whether the patients presented any reason for the test. The evidence further established the physicians provided prescriptions for narcotics, including opioids and benzodiazepines, as an incentive to patients who received the injections. Moreover, the evidence established that the dosage of opioids being provided to patients was suitable only for terminally ill cancer patients. Evidence from Michigan automated prescription systems showed that the 4 defendants were among some of the top prescribers of oxycodone 30 milligrams in the state of Michigan. In 2015, Pappas was the number 7 prescriber of oxycodone, Betro 18, Omar 16, Zahoor 38. At trial, oxycodone 30 milligrams was described as the gold standard of drugs diverted to illegal purposes on the street. Evidence showed that all 4 defendants were in the top 40 out of 50,000 Michigan prescribers, even though they had conspired with Rashid to stay under the radar of the U.S. Drug Enforcement Administration by working only a few hours a week. The doctors would see anywhere from 15 to 25 patients in a 2 to 4 hour shift and then bill Medicare for office visits and procedure codes suggesting they spend as much as 2 hours and 22 minutes with each patient. Every piece of the fraud was consistently implemented and applied to over 94% of the patients in the clinic. Alexander Pickus, 44, who managed medical clinics in Brooklyn and Queens, was also convicted of money laundering, conspiring to rip off the federal government, and conspiring to receive health care kickbacks. They are to be sentenced in the future. Hopefully the sentences will be severe and they will be required to pay the government back the money they stole. If you're interested in working to help defeat or reduce the amount of insurance fraud, consider purchasing my 2-volume work, Insurance Fraud, which is available at Amazon.com.